The grand opening of the Cleveland Clinic Lou Ruvo Center for Brain Health on July 13, 2009 was the culmination of the dreams, dedication, and hard work of Larry Ruvo and his family, as well as Las Vegas city leaders. All involved knew having a treatment and research center of this magnitude in the heart of Las Vegas was no gamble in this city of chance. It was a sure bet. It would serve the needs of so many suffering from neurological diseases, their loved ones, and caregivers. We sat down with the medical director of the clinic to look back at the last 15 years. Dr. Dylan Wint sees the most important accomplishments as less focused on medicine and more on people.
There are hundreds of thousands of visits that would not have happened. That means hundreds of thousands of interactions between patients, caregivers, and people who both understand the science and medicine of things, but also take time to understand what we're doing here.
But of course, the treatments and research being done here are also vitally important and groundbreaking, starting with the area of prevention and reducing the risk of Alzheimer's and other dementias.
For a very long time, it was thought nothing could be done to avoid these conditions, so your fate was set in stone. And then we started realizing that, well, some of the vascular components and even some of the vascular dementias, so these are caused by reduction of blood flow to the brain, that by controlling vascular risk factors, we can reduce those risks.
Improving vascular health often involves changing behavior, but those changes can significantly change the neurological path of a person's life.
Now we realize that through having a heart-healthy lifestyle, essentially, that we call, of course, a brain-healthy lifestyle, that people can reduce their risk, some estimate by as much as 30 or 40% of developing Alzheimer's or other dementias.
Aside from discovering how lifestyle can aid in reducing risk, there have been major breakthroughs in medicines to do the same.
Those medicines remove from the brain a protein called amyloid, which is part of the definition of Alzheimer's disease. A lot of people think of it as kind of the gatekeeper to Alzheimer's disease, that it gets things rolling. And if you can remove amyloid early enough, you can have a substantial impact on the progression of the disease.
For those already showing cognitive signs of early Alzheimer's or other neurological diseases, this discovery is groundbreaking.
This really is a huge moment. The fact that we have found a way to target the disease process itself and to slow down that disease process.
The hope is by combining vascular health and these new medicines, eventually we can go from a 30% reduction in progression to as high as 75%. Another area of pride here, care here is not only focused on the patient, caregivers have been a top priority here from day one.
We were doing caregiver education and caregiver support here before we saw our first patient. Patient care is supported by medical insurance and so forth. Caregiver care, education, not so much.
Studies and research are also priorities. This is one of the largest clinical trial sites for Alzheimer's and other neurological diseases. Dr. Wint says they have completed so many important trials, even though getting research participants is a trial in itself. Not everyone who volunteers qualifies.
Biggest obstacle that we've faced over the years in making progress in these diseases is lack of sufficient research participants. The sooner you can fill up a study with research participants, the sooner you can get results and put that drug on the market, or learn that that drug's no good and you got to move on to the next one, or understand how Alzheimer's disease affects a certain group of people differently than another.
Another mission here is to share the knowledge gained in this clinic with future medical professionals. Since the clinic opened, 4 fellowship programs have been developed. A woman's Alzheimer's movement prevention center is part of the landscape here, since women are diagnosed with the disease at twice the rate as men. The list of accomplishments goes on. So while this wonderfully quirky building has grabbed the attention of tourists and architects over the last 15 years, it's what takes place inside that is truly worthy of our attention. Research, education, treatment, and support for patients and their loved ones. It's what they've done here for 15 years. And fortunately for all of us, it's what they intend to keep doing.
discovery for the sake of discovery. It's not about even treatment for the sake of treatment. It's about fundamentally making lives better and fuller by treating the patient who's here in front of us now in the clinic, and also learning and developing so that we can treat the patient of the future even better than we do now. And that's really what we're about.
Nancy Byrne here. I hope you enjoyed that story. For more great stories about the city of Las Vegas, don't forget to click on that box.